Okay, good afternoon. We are headed into our final block. Let's see. Okay, so I'm Kayte Fisher. I am a senior attorney in the Health Equity and Access Office at the California Department of Insurance. I'm going to give you a couple of details. I'm going to skip a couple of slides because I've re-evaluated what we're doing. I've learned so much great information. I have way better stuff to spend time on. So CDI, very old state institution, was established in 1868. We regulate the largest insurance market in the United States and the fourth largest insurance market in the world. It's big. We regulate more than 1,400 insurance companies across all lines of insurance. We also regulate health insurers and products offered by we regulate health insurers and the products offered by health insurers, including some PPOs and EPOs, but not HMOs. I'm going to skip this. Important things we do, consumer services that are important for this group. Consumer services, accepting consumer and provider complaints, consumer education, and external appeals through independent medical review, market conduct, and enforcement. Those are really important for this group. We'll not talk about legislation for this. So this, we've talked about, other people have also presented versions of this, but just to give you in California, a little breakdown of how complicated this is. You know, to start with, you've got employer-based coverage and then individual coverage. Individual coverage primarily being through the exchange or sometimes off-exchange products. The commercial market, so once you've got employer, the commercial market, which of fully insured, is about 11.8 million people and self-funded about 5.8 or 6 million. And then you break that down into large groups, small groups. Student health is treated like individual health insurance. Anyway, I only present this to explain even more that it's so complicated. In fact, it's complicated. What I do want to emphasize that from the patient and provider perspective, in California, recognizing that it's so complicated, we do have reciprocal agreements with other regulators, DMHC, and also somewhat with Department of Labor, who's the federal regulator. If you have your health insurance, you're having a problem, and you want to contact a regulator, go ahead. You don't have to guess. Just call either CDI or DMHC, and we will get you routed to the correct place. We'll either tell you, great, you're in the right place, or no, you actually need to be in another place, and we will send all the information you have submitted over to the place and we'll hand you off. So don't be intimidated, just make the call and we'll make sure you get to the right place. Which brings me to make the complaint, just do it. I want to acknowledge that me and everyone I work with understands that to the point of every patient perspective we've heard, when you are in the thick of a horrible health crisis, contacting bureaucrats is not the thing you want to be spending your time on or your energy. It's really hard. That said, the only way we know.
It's a kind of smart TV. So it's like our TV downstairs. It's like every show.
Fargo, can you mute the person who's speaking?
Yeah, I'm working on it right now.
Sorry. So that said, I know how hard it is. It's hard for me. I'm a healthcare consumer. It's hard for me to even make complaints and to take actions on things that I know are wrong. However, unless you make a complaint, no one knows it's happening. It's like a tree falling in the forest. If no one sees it, no one knows it happened. And if no one knows it happened, no one can help you fix it. I just want to say, like, you know, I heard earlier that when she said she made 16 calls and got bad information, that's not acceptable. And it shouldn't be the norm and it shouldn't be happening. That's definitely a situation that you should be making calls, because unless this gets documented, nothing can be done to fix it. Made a note, an unquantified problem in group of data researchers, an unquantified problem does not have a solution. We cannot fix what we don't know is wrong. I also want to say, don't hesitate to push back when you feel like you're not being listened to, whether that's your insurer, whether that's a regulator, whether that's, you know, anyone who you feel like you are not getting listened to. Don't hesitate to push back. Don't hesitate to push for time deadlines to be met. Someone will eventually hear you, and we will do our best to try and make sure that things get made right. Oh, I just wanted to give a little example of like what a complaint form would look like. This is if you submitted a paper complaint to CDI or DMHC, this is sort of what it would look like. Some of the information that would be asked for. You can, without doing it on paper, you can submit it online on the portal, and it's pretty easy. To the point that some people have made about urgency, there's a box that you can check that says this is urgent, and it will be responded to within a much tighter time frame. There's time frames and regulation for that. There is a spot here for describe your problem, tell your story. It needs to be heard, and tell it in detail. All of it matters. I have heard a fair amount today that I can immediately identify as some violations. And I would like to encourage everyone, I mean, I don't care if it happened 2 years ago, make the complaints. Unless we gather the data, we don't know that there's a pattern and practice of problems. So please, providers can, and providers can submit complaints about insurers, providers can submit, complaints of all kinds, as can consumers, and we need to hear them. Things like lack of access to medically necessary outpatient prescription drugs, big red flag. Lack of network providers. There are network adequacy rules, and if you're not getting access, those are problems. We need to hear about them. My research question is, what we at the department need to know more about is what is and what is not working in the consumer complaint and appeals process. I know what it's like from myself as a consumer. I think there's room for improvement. And we need to know from you as providers and patients, what are areas that we can fix, what small, large, overhaul the thing completely. Let us know. This is what we want to know. So that's it.